Hey guys, and welcome back to Little U Life. I'm Dr. Gibson Gray, and today we're talking about something extremely common to many preemies, but often difficult to understand: neonatal respiratory distress syndrome, or RDS for short. We'll dive deep into the causes and the treatments for this condition, so grab your pens and let's get started. So what is neonatal RDS? Well, think of your baby's lungs like balloons that inflate and deflate with each breath. The first breath of blowing up a balloon is usually the hardest. And the second, third, and fourth breaths are easier. In newborns, sometimes these balloons need a little extra help to inflate properly. This is where RDS comes in. Inside those tiny lungs, there are tiny air sacs called alveoli. These sacs are like little cushions where oxygen enters the blood and carbon dioxide exits. But in babies with RDS, these sacs can be a bit stiff and thick and hard to inflate because they don't have enough of something called surfactant, which is made by the lungs starting around 28 to 32 weeks. The development of artificial surfactant and the widespread use starting in 1990 completely changed how we care for our premature babies and improved survival at a much earlier gestation. Surfactant helps our lungs stay a little bit open when we breathe out. Without it, these air sacs completely deflate after every single breath. And each breath is like that first breath into a balloon. It's hard. With surfactant keeping the alveoli slightly open, it helps each breath be a little easier, like that second or third balloon breath. So why does this happen? Great question. In some cases, babies are born before their lungs have fully developed and haven't really had time to make enough surfactant. This is more common, obviously, in premature babies, but surfactant deficiency can also happen in about 5% of babies born at full term for various reasons. Without a proper amount of surfactant, the alveoli can be thicker and less flexible, making it tough for them to breathe easily. Babies with RDS might show signs like rapid breathing, flaring nostrils, or even a bluish tint around their lips or tongue called cyanosis. They also may have something called retractions, which is when we can see their ribs when they breathe. All of these are abnormal. When we look at a chest x-ray of a baby with RDS, we actually see a very characteristic appearance of their lungs. It often is described as a ground glass appearance. But the good news is that we have ways to help babies with RDS. We might just need to give them a little bit of extra oxygen or sometimes some extra pressure with a mask called CPAP to help open their lungs up better. But on occasion, we can even need to give them some surfactant directly into their lungs to make those alveoli more stretchy. Sometimes a baby may need to be on a breathing machine or a ventilator to help with RDS as well, but this is not always the case. Currently, we have to give surfactant through either a breathing tube or a small thin catheter into the lungs. However, a lot of research is being done to develop a surfactant product that can be given by breathing treatments without the need for tubes or invasive procedures. But remember, every baby is unique, and like every baby, every RDS case is different, and it is just one of the many things that can challenge some babies early on in their NICU stay. But with the right care, love, and support from you and the medical team, your baby is in good hands. So, there we have it. Neonatal respiratory distress syndrome might sound complex, but it's just a way of saying your baby's lungs might need a little bit of extra help. As always, if you have specific questions about your baby's care, stay connected with your doctor, ask questions, and enjoy every precious moment with your little one. Who is your why? Thanks for tuning in, and we'll see you next time.